students, in today's class we are going to see about the role of government in health, right. In the previous class we have seen the chapter 1, in today's class we are going to see the chapter 2, right. So, here, what do you mean by health? Health is something that physically present, physically as well as mentally strong. So, what do you mean by health? Health refers to free from any kind of injury or illness, as well as it does not represent physically only but also mental health also. Physically fit but also mentally strong. So, the term health, which refers to free from any kind of injury or illness, as well physically fit but also mentally strong. Next, we will see about for proper health, what are the things needed? The things are like, the main thing, the good food is essential for a proper health, right. Next, the progress of health. The health sector in India has expanded quickly over past few decades, as well as at present India has a largest number of doctors as well as nurse and technology advancement is in the hospital sector, as well as the foreigners, the persons who are living abroad also, they are coming to treatment to India because of there is a low cost medicine as well as advanced technology has been there in India, that is in hospital sectors. Next, advanced healthcare facilities such as well maintained hospital, well equipped laboratories, blood bank and ambulance services are essential for the prevention of cure of the disease. As well as these facilities also include healthcare services provided by doctor, nurses, and the doctor diagnose the treat disease, nurse and hospital for support of the staff members and clinic assistants help the patient to recover faster. Some of the issues as faced by the health sector are in the rural areas, there is a poor healthcare services provided to them. So most of them are affected in the rural area, and then poor healthcare facilities in rural area, and as well as the main thing is about the drinking water facilities are not provided in a good manner. So drinking facilities, drinking water, there is a bad drinking water, so that it will cause some of the diseases, right? So there should be provided a good drinking water facilities, and then it will cause diseases, right, like borne diseases. Borne diseases, what are the borne diseases, students? Like typhoid and cholera. Typhoid and cholera. Right. Drinking water, there should be proper drinking water. If there is not a proper drinking water, some of the disease will be there, that is borne diseases like typhoid and cholera. The next issues is that nutrition. Nutritious meal. Leading to malnourishment. Right. The next main issue is nutritious meal. So it will lead to malnourishment. Here the term malnourishment, which means that is lack of nutrition, that is lack of nutrition. While the students, the children do not get any nutritious meal, it will lead to malnutrition. So there will be lack of malnutrition in them. Next, the next issue is about high healthcare, the cost often lead people to delay treatment. So that there will be aggravating problems. the next thing is about cost often leads to people to delay treatment, aggravating problems. Here aggravating problems, which means increase it, that is expanding. So while there is an increase, that is while the cost has been increased in the medical sector, automatically the people will delay in the treatment. So the problem will aggregate. So while the problem, that is while the disease has not been rectified in a correct time, automatically what will happen? It will aggregate the problem. So the cost should be in a low manner, right. These are some of the issues faced by in the health sector. Next we are going to see about, now we are seeing about the progress, right. Next we are going to see about in health sector what are the types, right. In health sector there are two types, right. They are public health sector and private health sector. So the health sector in India, the health sector has been divided into two major categories. One is public health sector and another one is about the private health sector. The first one is, we will see what is in public health sector, right students. In public health sector, in public health sector, it has been owned and it has been controlled by the government of India, right. It has been controlled by government. Controlled by the government. As well as India is a welfare state. So the main role of the government is that it should be provide, that is it should provide the proper maintenance, like in both the rural as well as in the urban areas. The both of them should be given equal importance, right. So the duty of the government is to provide both rural and urban areas. Medical facilities, should be provide medical facilities in both rural and in urban area. As well as the illness has been supervised by in primary health care centers at village level. In village level, it has been supervised by what? Primary health centers. What is the expansion of PHC? The expansion is just primary health center, and in at national level it has been the institute like aims, right? You have heard about aims, right students? The expansion is that all Indian Institute of Medical Service. Institute of Medical Science. So, at village level, it has been supervised by PHC. The expansion is the primary health center. At national level, the institute is aims, and the expansion is All India Institute of Medical Science. Next, the thing is that as well as the government has taken many steps. So, the government had taken many steps to provide the medical facilities to all the people. The common thing is that the polio drops facilities has been provided to all types of students, both in rural as well as in urban area, right? So, government hospital provide public health care services. Either at free of cost or at a nominal rate, right? These are some of the public health sector, some of the issues, as well as some of the government has taken some of the steps to improve the medical facilities in India. Next, we are going to in private sector. We will see about private sector, right? In private sector, it has been owned by an individual, a single person, right? So, coming to private sector, in public sector it has been owned by the government, whereas in private sector it has been owned by the individual. In private sector, that is they will provide all the things, all the facilities like public sector, but some of the doctors are engaged in the services in the urban area. So, doctors give as well as in private sector, they have an equal, that is new technology has been, the equipment also been there, as well as the same treatment also given, but they are focusing on the urban areas. Like doctors are creating private clinic, to provide healthcare services. Healthcare services. And then in it, the major difference in public and private sector is that the cost matters. Cost, right? In public sector, the government will provide at free of cost, while in private sector there will be increase in the cost, because it is owned by a single individual, that is they will only fix the cost, so there will be increase in the cost, right? So this is a common difference between the public and private sector. And so that there will be, coming to in private sector, there will be no increase in cost. It will not, the persons who are living in the economical background below cost, so they will not have a clear idea in private sector, so they will not go for the private sector hospital, as there is increase in the cost. The next thing in private sector is lack of clean environment. In private sector hospital, there will be lack of clean environment. They will not be provided a neat environment. There will be not as well as the nutrition tablets that will not be given in a proper way, proper nutrition, right? These are some of the things in the health sector, as public as well as in private sector. So the next thing is about how to, there is improvement in medical facilities in our country. Improvement in medical facilities. The improvement are, in the year 1996, the Kerala government has made some of the changes in function, right? In the year what? 1996, it brings a changes, that is in Kerala government. That is, it allocated 40% of state budget to panchayats. Panchayats. So here what do you mean by panchayats? The person who are residing over the villages is known as panchayat. So 40% of the state budget to provide to panchayat. So by providing them to panchayat, there will be, so that they will see to whether there's been provided drinking water in a well manner, clean water, right? Drinking water as well as food, education, and your education. So they will monitor the thing, monitor as well as whether they are provided in a good manner and whether they are receiving the drinking water, food, all the things. So in education it has been divided into two types. One is the function of the school as well as the Anganwadis. Here Anganwadis, which refers to the primary health center, that is the students, right? So child care unit. Anganwadi, which means child care unit. Anganwadis. Spell the word Anganwadis. A-N-G-W-A-D-I-S. Anganwadis. I repeat, A-N-G-W-A-D-I-S. It refers to child care unit. Right. These are some of the things to improve in the medical facilities. So in Kerala in 1996 this has been introduced. 40% of state government, that is state, has been allocated budget to panchayats, so that in panchayats the thing is that they will see over it, that is supervise, and the drinking water, whether the people are getting the drinking water, foods and education in a proper manner. And therefore let's recap. What are the things we have seen today is what do you mean by health, right? First we have seen about meaning of health. Next, the healthcare facilities, right? Healthcare facilities. That is, the healthcare facilities has been divided into two. One is what, students? Two sectors I said, no? One is what? Public, and another one is private. Public is owned by government and private is owned by the single individual or a person, right? Private. Next we have seen about Above we have seen health care facilities. Next we have seen about what the improvement, right? Improvement as well as how healthcare facilities are distributed in India. Healthcare service. Distributed in India. Next we have seen about how to improve the healthcare facilities. Right, these are the things. The assignment is that difference between assignment. Difference between public and private healthcare service. Care service. Right, this is assignment, right? That's all for today's class. The role of the chapter 2 has been ended. Thank you.